Thank you very much, Dr. Etches, Vera. Thank you very much for having me. Good morning, everyone. Thank you for joining us this morning. Bonjour à toutes et à tous. It's always great to be back at CHEO. In my capacity, I just self-describe myself as the MP for CHEO. Having worked here for 2 years part-time in the emergency department, my mother nursed here for 27 years. And 2 or 3 of my siblings also served here as porters, either in the emergency or on different floors. So it is a special institution for us, certainly for me as the MP for Ottawa South. This is a real gem. It's a real gem in our region. It's a gem for our city. A gem for our this region is growing, 3rd or 4th fastest in the country. Demands are increasing. So this is a special part of our looking out for each other. As I was saying to Dr. Etches earlier, it's a really really big, important place for so many families. I'm really happy to be here on behalf of my friend, the Honourable Julie de Brussen, Minister of the Environment, Climate Change and Nature, to celebrate an important milestone in our efforts to build a cleaner, as Dr. Etches just said, a more sustainable future. We're celebrating the successful completion of CHEO's Deep Energy Retrofit Program, which received $1 million in funding from the Low Carbon Economy Fund's Challenge Fund. So thanks to this investment, this hospital has installed a new energy recovery system and retrofitted its heating, ventilation, and air conditioning systems. In addition, 2 new heat pumps will help reduce energy consumption and reduce costs. This is climate change action really demonstrated. It is leadership in environmental sustainability and fiscal responsibility. Both are key to the long-term viability of our essential public services and the strength of our nation. We all know that because we're all breathing right now at a very difficult time with fires raging. We are committed as a government to supporting organizations, municipalities, businesses, and institutions that are embracing energy efficiency to improve the health of Canadians, the resilience of our communities, and the strength of our economy. Les travaux réalisés dans le cadre du programme de rénovation énergétique approfondie du CHEO démontrent un leadership fort en matière de durabilité environnementale et responsabilité fiscale. Ces 2 priorités sont essentielles à la viabilité à long terme de nos services publics et à la force de notre pays. Le gouvernement du Canada s'engage à appuyer les organismes, les municipalités, les entreprises et les institutions qui adoptent l'efficacité énergétique pour améliorer la santé des Canadiens, renforcer la résilience de nos communautés et stimuler notre économie. The project shows what can be achieved when governments, community organizations, hospitals like this one actually work together and combine their efforts towards a common goal. It also demonstrates that climate action and economic responsibility go hand in hand. Every dollar an organization saves on energy is a dollar that can be redirected to support their core mission, like here, children's health. That means more resources on what matters most, delivering exceptional care for our kids, our youth, and our families. I want to congratulate everyone here for helping bring this project to completion, including the CHEO team and all project partners, your engineering crews, your designers, perhaps even architects. Taking this on and executing this is really a very important project for people to be aware of, because we need to do much more of this as we go forward. And right, of course, in Eastern Ontario, right here in parts of Western Quebec, all the way to Nunavut, CHEO has touched the lives of countless families. I've just come back maybe 10 days ago from Kuujjuaq, meeting with our leadership for the Greater Arctic, had a discussion about the link between this hospital, the Ottawa Hospital, and the Eastern Arctic. And as Minister of Defence, I have a responsibility to also look at healthcare and dual-use investments, not only for members of the Canadian Armed Forces, but for the good people who live in our Arctic, in our high Arctic, who exercise our sovereignty at a time when we are very aware of that need. So today's milestone is a reminder that investments in sustainability strengthen our institutions and our communities, which we rely on every day. Thank you, everybody, for your leadership, for your partnership, your commitment to building a healthier and more efficient future. We need more of this. We need more of these projects. Very proud to be here. I want to thank all the officials at Environment Climate Change Canada, my colleagues, my former colleague, Minister Guilbeault, for helping us launch this. It's a team effort. Thank you for making it real, because at the end of the day, the change we want to affect has got to be measurable. The metrics have to be disclosable. We can talk about climate, we can talk about energy efficiency, but if we don't make the actual investments that allow us to make progress, then it's really talk. This is what our government is now focusing on. The Prime Minister made these comments yesterday very clearly when he was asked about wildfires and climate, and made it clear that we're looking for operationalizable change, measurable outcomes, measurable reporting for advancement, and this is a perfect example of an infrastructure project that's making a real difference. So thank you very much to all of you. Merci. Thank you.
Merci, Ministre. I'm now very happy to invite Dr. Curtis Lavoie to further describe what this project means for CHEO.
Thanks, Dr. Etches. Mr. McGuinty, those are amazing comments, really. I appreciate everything you've said there. For those of you who don't know me, my name is Curtis Lavoie. I'm an emergency physician here at CHEO. I've been here for more than a quarter of a century. And I'm also a founder of the CHEO Green Team from many years ago now. And as part of that and my general interest in sustainability, I've been working for this time. I've been doing a lot of work through my practice and through research looking at the intersection of environment and human health. And I can tell you, first of all, as healthcare providers, we see firsthand how the environment impacts health. We see it in the respiratory illnesses that we see on a daily basis, now year long. We see it in the infection vectors. I'll tell you, I'm seeing infections nowadays. I've lived through infections that 30 years ago I didn't even hear about in medical school. And as well, we're seeing more impacts from extreme weather events and the really impressive and unfortunate impact on families and children almost on a daily basis nowadays. Vera spoke about CHEO's aging infrastructure, and I want to say it's really impressive what we've been able to accomplish here at CHEO due to work on everybody's part. This represented a challenge, but also an opportunity. Our existing mechanical systems are approaching the end of their life cycle, and what that means is that they're no longer operating at a full efficiency, and continuing the status quo would have meant much higher costs, but also much higher greenhouse gas emissions as a result. And these increasing costs and consumption are obviously something that's very important to avoid with respect to the environment and human health. Thanks to this $1 million grant, CHEO has been able to invest in this critical infrastructure and really improve and modernize our key systems at the hospital level. This increase in efficiency has really helped us to address the long-standing challenge that our facility has, and also support a much broader commitment to sustainability and stewardship. The impact of this investment is significant. The new system will help us reduce our emissions, as I said, lowering our environmental footprint and supporting a healthier future for our community. The new systems are expected to reduce our consumption by approximately 2,500 tons of carbon dioxide per year, which is the equivalent of really the energy consumption of at least 1,000 individual homes on an annual basis. These improvements will contribute to improving our energy performance, but also help CHEO to continue with a more sustainable future. What excites me most, though, is the benefits to human health that extend really beyond just our environment. Cleaner air, lower emissions, and more sustainable operations means that we really support better health outcomes for children. Children here at the hospital, children in our community, children across the planet. The project demonstrates that these investments are really not just about sustainability, but really investments in human health. On behalf of the CHEO Green Team, on behalf of all of us at CHEO, on behalf of the children of our community, thank you. And I'm going to say it extends across the planet, and I really think it's important. Your support in creating this meaningful and lasting impact is really for everyone, and especially the children. Thank you.
Thank you. You can hear the passion and that dedication to the well-being of children and the link with the environment and the sustainability. You've made a difference. You are continuing to make a difference as part of the founding members of the Green Team, and just thank you for making that real for people. That this is about numbers, Minister McGuinty. We are delivering the numbers and the savings, but ultimately it's about well-being as well. So. We are very grateful. These kinds of projects require partnership, and so we thank the ministry again, folks from Environment and Climate Change Canada. You know, we are continuing to modernize our facilities. We will be looking to the next steps and continuing to create healthier spaces for our children and our youth. We're continuing to grow, and we'll keep in touch about future infrastructure projects. But today it's all about a thank you and making this difference. We're very proud of this work and appreciate your presence to celebrate with us. Merci beaucoup. C'est incroyable d'avoir cet progrès. As a result of your support, we're very thankful. That's it today. That wraps up our event. I think that there is going to be a tour for those who are able to stay, but also opportunity maybe we have time for one or two questions, so I'll pass that over to the moderator.
Thank you, everyone. That now concludes the announcement. Thank you, merci. We'll open it up for questions. One question, one follow-up. Please state your name and outlet, please.
Hi there, Mackenzie Gray with Global News. Questions for Minister McGuinty. Vera Etches? Yeah, for you, sir. Sorry. I'd like to ask you about the trip we were both recently on to Saudi Arabia. The announcement from the Prime Minister included a MOU on defense cooperation, saying there'll be a defense attaché in the embassy in Riyadh. Can you outline what guardrails the Canadian government will have for selling arms to Saudi Arabia, a country that has had a very spotty human rights record?
Yeah, so you're right, Mackenzie, that we formalized the arrival of a new defense attaché in our embassy in Riyadh. We've got new defense attachés around the world. We are expanding our relationships into the Middle East, into the Indo-Pacific, and elsewhere around the world. The question of balance between human rights, trade, and those relationships is achievable. The Prime Minister made it very clear that sitting in Ottawa and not engaging in relationships with other countries is not always a productive approach. So we're going to make sure that the export permit system at Global Affairs Canada is going to continue. It's going to continue to do what it does, which is evaluate transactions. It always has. Positive discussions were had by my colleague, Minister Anand, with her counterpart in Saudi Arabia on the human rights front. That understanding is being communicated. But one thing we know for sure is that you cannot communicate that understanding if you don't talk to each other, if you don't have dialogue, if you don't have relationship. So part and parcel of our mission, not just to Saudi Arabia, but many countries in the region and elsewhere, is Canada's exercising its values in the world, but we're also capable of pursuing trade opportunities. We're moving to grow our economic pie. We're moving to make of defense an important industrial sector for the country's future. Just yesterday, the Prime Minister and I were at General Dynamics Land Systems announcing a special relationship with a company that's employing 600 small and medium-sized enterprises, has 1,700 employees and families on their payroll now, and 10,000 additional employees around the country. So we see this as an integrated approach to our domestic economic situation and our international relationship.
There is, though, a difference between having a conversation and engaging with someone and selling them arms. The Canadian government has issues before. The light armored vehicle deal was very controversial. Saudi Arabian government didn't pay Canada for many years for that deal.
Yeah.
There have been credible allegations from NGOs that the Saudi government has used military equipment on their own people. Why would Canada want to engage in arms business with a country that has a record like that?
We're confident that the export permit system that we have in place now will play an important role on any eventual sales to any country. That's something that we examine regularly at Cabinet, for example. So those discussions will continue, that process will continue. And those conversations, those issues were raised with our counterparts. Not raising those issues, acting like two ships crossing in the dark, as the Prime Minister indicated, is not particularly productive. We need to engage with the world, and we are engaging with the world, which is why we brought a balanced approach to our relationship in Saudi, and those conversations will continue. Thank you.
Good morning, Minister McGuinty. Natalie Van Roy with CTV News. I wanted to ask you, what role will the government play in helping with the Ontario forest fires?
So right now the Minister for Emergency Preparedness is engaged and has been dialoguing for constant touch with the province now for probably 2 weeks in anticipation of what's happening. Already now we have people on the ground. We've been providing backstopping. No formal request has come from that department to the Canadian Armed Forces. We're on standby. Our personnel's on standby. Equipment's on standby, but we are helping under other authorities now to airlift people out, to move people out. We're waiting for a more formalized ask. Right now the province of Ontario and the Ministry of the Department of Emergency Preparedness are apparently capable to handle the situation with some backstopping from defense. But if it gets to a level where they require a more direct and immediate support from the Canadian Armed Forces, like always, the women and men of the Canadian Armed Forces will be there.
And would that include evacuations?
That would include evacuation. For the last several years, the Canadian Armed Forces have been called in to assist with evacuations across the country with different situations, Manitoba, Ontario. And so I anticipate, I'm always on standby. Our teams are in constant touch with Indigenous leaders, with the province, with community leaders, elected officials. Our people are on the ground conducting assessments. The government's emergency center is fully engaged on this 24 hours a day. That is something that is handled by the Department of Emergency Preparedness. And so we are, as I say, on standby to see whether we need to kickstart more Canadian Armed Forces supplies, equipment, airlift capacity. And we'll know more, I'm sure, about this in the next several hours.
Thank you.
Thank you.
Bonjour.
Bonjour.
Sébastien Dudroit, c'est une question pour vous. En français, j'aimerais vous entendre sur ce projet-là, ce que cette annonce va changer pour les patients, pour les familles qui viennent au CHEO, parce que ce n'est pas encore clair pour moi.
Ok, oui, je m'excuse, je peux ajouter plus en français. Le projet a amélioré la qualité d'air. Ça, c'est bon pour notre patient et les familles ici. En même temps, c'est avec un processus qui utilise moins d'énergie. Alors, ça donne plus de l'argent pour d'autres services de CHEO. Alors, on peut gagner les fonds d'avoir une meilleure opportunité d'investir dans le service des soins. Ça, c'est une autre méthode ou une autre route pour bénéfice pour les patients et les familles. Le grand effet, si beaucoup de gens avec nous, d'autres organisations continuent avec ce processus d'avoir de réduire l'impact sur le climat, ça c'est aussi important pour la population. Parce que maintenant, le changement dans le climat, ça, c'est un grand défi pour la santé des gens, les enfants aussi. Est-ce que c'est un peu
Oui,
plus?
c'est plus clair. Puis ma
Ok.
deuxième question, c'est on voit que dans l'Outaouais, puis en général, au Québec, il y a une surcharge des urgences qui a été rapportée beaucoup de fois. Je voulais savoir au CHEO ce qu'il en était. Est-ce que vous avez vu dans les dernières semaines des urgences qui étaient surchargées?
À CHEO, c'est important pour nous de réduire les files d'attente à notre urgence et on a quelques réductions dans l'attente. Concernant cette semaine, je n'ai pas les chiffres pour cette semaine. Je pense que c'est une tâche de santé publique à Ottawa de faire la surveillance concernant l'impact, par exemple, de l'air, le fume dans l'air. Cet impact, c'est quelque chose que Santé publique à Ottawa évalue. Mais pour nous, on continue d'avoir la capacité de fournir service à la population dans notre urgence.
Merci beaucoup.
That now concludes our questions for today. Thank you, merci.